I think for years and years and years, countries have actually, many countries in the South are much better than countries in the North at delivering mass population-based vaccination. They've proven it again and again with yellow fever, with meningitis, with cholera, with Ebola, with polio, with measles. Again and again, millions and millions of people have been vaccinated in single rounds of vaccination, injectables, non-injectables, orals, in the most extreme of circumstances. And quite frankly, and I'm not saying this to you as journalists, I know this question is being asked, so you have every right to ask it and reflect that concern. But the level of paternalism, the level of colonial mindsets that say we can't give you something because we're afraid you won't use it. I mean, seriously, in the middle of a pandemic, that is the logic that may underpin the non-distribution and non-sharing of vaccine. I'm not saying that's your sentiment as a journalist. Your job is to ask the questions. But if that's reflecting a mindset of justification for not sharing, then we really are in trouble.
Yeah, thank you. I think Mike had already said it in a very blunt way, so, but I would still like to add, because it's very, very important. I don't want, I mean, the question, as Mike said, you're asking a question and there is nothing wrong in asking a question, but the problem is if countries use it as a pretext not to share or not to give those. The reason we're really concerned and what, why Mike said and Bruce said what they said is, it happened in the past. You know about HIV treatment and what some of the arguments were, and where some were trying to justify that, you know, especially in low-income countries, people cannot use, you know, HIV treatment, which is very complicated, so we cannot share it with them. I mean, that attitude has to be the thing of the past. And what I would like to assure those who are prepared to give vaccines is, we have done our homework with the World Bank, assessing countries, identifying the gaps, helping them with filling the gaps, but at the same time, they have experience of using or implementing mass campaigns for several years. So they have the experience, but we also try to work with them if there is, to see if there is any gap. So the shortage, the problem now is supply problem. Just give us the vaccines. You know, some people were asking me about vaccine hesitancy in Africa. And then I say, that's not the problem. There is no vaccine, so why do we even talk about vaccine hesitancy? The problem is vaccine supply. And even now, it's not the absorptive or the delivery problem that's a problem. There is no vaccine. You can't even talk about delivery or absorption capacity when there is no vaccine. So the problem is lack of access to vaccines. And that's causing a two-track pandemic. Those who have vaccines are getting better significantly, and they're opening up their society. Those who don't have vaccines are facing serious COVID situation with serious surges in cases and deaths due to COVID. That's the reality now. So let's be real. What we need is vaccines. The problem is lack of vaccines. It's not delivery, it's not, you know, problem in absorption by and large. We can have that maybe when we have more vaccines. It's lack of vaccines. It's not hesitancy, it's lack of vaccines. And the situation in many countries, in low-income countries, especially in Africa, it's very worrisome. I said it many times. And I sent a tweet, actually, I posted a tweet yesterday about the worrying trend in Africa. It's becoming so dangerous. And the difference now is between having a vaccine and not having a vaccine. The difference is between the haves and the have-nots, and which is now completely exposing the unfairness of our world, the injustice, the inequality. That's it, let's face it. And that's the problem. And we need vaccines now. That's the issue. Then let's try. If absorption or delivery is a problem, let's see it. If hesitancy is a problem, it's not. Of course there could be a problem, but that's marginal. That's secondary issue. That's secondary issue. We need vaccines now to save lives. And let's not go around the bush now. We need vaccines, that's the problem. And I will tell you another story. I had a meeting with the allocation team. There is an advisory group we established that can help us to allocate vaccines that's coming through the COVAX. They're frustrated. They're disappointed because there is no vaccine to allocate. No vaccine. So there is no allocation if there is no vaccine. What do you share if there is nothing to share? That's the reality. So let's focus. And as media people, please, you know the truth. Just focus on what is failing. The world, as international community, as the world is failing. As global community, we're failing. We're repeating the same mistake as HIV/AIDS, which took 10 years to reach the low-income countries, after it was already rampant in high-income countries, and the H1N1 vaccines that was delivered to low-income countries after the pandemic, after the epidemic was over. Do we want to repeat the same thing? Can't we learn from what happened in the past? I think you know the answer. Please help us mobilize so the world comes back to its senses and help us open the world.
Now be the first to know about the latest updates on our new news app. Go on your Android or iOS, search for HW News Network. Download our app, choose the language you prefer to get updates in, and be up to date with the latest news.